Hello doctors, have a beautiful day. This is Dr. Hub, a passionate doctor mentoring worldwide. Prostaglandin synthesis. So firstly it begins with the cell, membrane, phospholipids. So next step is the formation of arachidonic acid. So in between this step, there is involvement of phospholipase A2 as well as the phospholipase C. So this step is inhibited by the steroids. Next, this arachidonic acid in presence of the other lipoxygenases. So this forms the HPETs and forms the HETE. Now moving forward, the arachidonic acid, it leads, on one hand it leads to the formation of HPETE. So this is nothing but the hydroperoxy eicosapentaenoic acid. So here this again leads to the formation of lipoxin A4, lipoxin B4 and the inhibition of inflammation. So this is in presence of the 12 lipooxygenase. Next what we see is the HPETE, it leads to formation of leukotriene A4. This leads to next C4, then D4 and E4. So this leukotriene A4, this in presence of water, it leads to LTB4 and this causes the chemotaxis. On the other hand, the glutathione, it enters before the C4, the glutathione enters. So as this enters, it leaves as the glutamic acid. On the bigger side, the C4, D4 and E4, it contributes to the bronchospasm as well as increase in vascular resistance, vascular permeability. Now moving ahead, the arachidonic acid we saw. In one hand, the arachidonic acid, it went to the HPET. So the other hand, it leads to the formation of the prostaglandin H2. That is nothing but the PGH2. So here, what are the enzymes which are used? That is the PGH2 synthase, the cyclooxygenase, that is a COX-1 and COX-2 as well as the peroxidase. So along with all of this, it forms the prostaglandin H2. So the inhibition of this step is by the COX-1 and 2 inhibitors respectively, as well as aspirin and the indomethacin. So we went with the prostaglandin H2, that is PGH2 formation. So this again it leads to the PGD2 and PGE2. Next, it also leads to the formation of PGE2 and PGF2, and it also leads to the prostacyclin, that is PGI2, and on the other hand, the thromboxane TXA2. So now looking at the enzymes involved. Here the enzyme involved is PGD synthase. Next, the enzyme involved here is a PGE synthase. Here it is prostacyclin synthase. And next, here it is the thromboxane synthase. Now this PGE2, it causes vasodilation as well as increase in the vascular permeability. Then the PGI2, this is in the endothelium. So this causes again the vasodilation as well as it inhibits the platelet aggregation. So next we look at TXAA2. So this is in the platelets, and what this does is it causes opposite of the PGI2, that is it causes vasoconstriction, and it increases the platelet aggregation.